Welcome to the latest edition of Call the Doctor, a regular Workers' Party programme looking at all things NHS with the great Dr. Bob Gill, a campaigning GP, who is the producer of the seminal film, The Great NHS Heist, which talks about the threats to our National Health Service. And I wanted to, this week, Bob, just to return to the discussion that we started to have last week about the impact of private healthcare, particularly because Nigel Farage has gone on the record again saying that he doesn't support the publicly funded National Health Service. And obviously he's somebody who is looking to emulate the US model, which clearly leaves millions and millions of Americans well short of the healthcare cover that they need. And I wanted to just start, if we can, hoping we can play this recording of a young woman in the States who is health insured, and she just talks about what happened to her. And if we go down this road in the UK, this is going to become a regular occurrence here in the United Kingdom as well, and hopefully will alert people to the fact that we absolutely have to resist any notion that we abandon the system we have at the moment, with all its faults. I mean, there are many faults with it that need to be ironed out. But if we end up sort of going down the American model, if it's just talk about throwing the baby out with the bathwater, it would certainly be far worse than that, because it would leave everybody in a much more precarious situation than they are at the moment. Particularly the poorest people in the country would be the most vulnerable, I think, to the failings of the insurance-based healthcare system that they have in the United States. But Chris, our technical guru in the gallery there, can you just play that clip of that young woman talking about her experience, Chris, now?
Sure, Chris. Doing that now.
Thank you.
Okay, item number one of the things that annoy me. I am a young, healthy person. I don't have any medical conditions. I don't take any medications. I've been to the doctor once in the last, I would say, 2 to 3 years. I pay out of my own pocket $1,000 a year for health insurance. My employer puts around $4,000 in per year. And really what that means is they take $4,000 from my salary and put it towards health insurance. So right there, we're at about a $5,000 insurance plan, right? And I haven't even used my health insurance in the last couple of years. I went to the doctor's office recently, had a singular office appointment for one complaint. My insurance didn't cover the entirety of that visit. It cost me an additional $300 to include some lab work. But not only that, so now I'm out, we'll say $5,000 plus $300 out of pocket that wasn't covered for this office visit because I haven't used health insurance the rest of the year. My insurance denied the medication that was prescribed to me. So I paid all that money to health insurance and I can't actually get what I need. And I, as a physician, see these stories a million times a day, but I've never really felt comfortable sharing other people's stories. So this is something that has happened to me, and so I feel like I can share it. And it's just absolutely absurd that we are allowing the insurance companies and the healthcare system to function this way. And so that is really why I'm coming to TikTok, because I'm annoyed, I'm frustrated. I've seen other physicians start to do this kind of thing, and I'm wondering if, building some online presence and helping other people become informed would be helpful. So that's my story.
So, Bob, just give us your reaction then to that young woman's experience.
So, first of all, it's very good to hear that some doctors are actually making their views known in terms of how doctors themselves are suffering at the hands of the private insurance industry. And what she lays out there is her insurer forks out £4,000 a year. She contributes also to her private health insurance, only to find that when she needs the insurance to cover a cost, first she has to pay out of pocket for a certain amount, maybe $5,000, maybe $10,000, before she even qualifies for the insurance. And then she's at the mercy of the insurance company, who then decide whether to cover the cost of her treatment. It's absolutely scandalous. And the point of insurance is to put your mind at rest that you'll be covered when the need arises. But clearly the health insurance model that the US run doesn't do that. It's a mechanism of fleecing people when they're well and leaving them high and dry when they're sick. And for any politician who has any notion of serving the best interests of our country to adopt the most expensive, most dysfunctional, most fraudulent system in the developed world is a gross betrayal on top of ignorance, on top of a lack of humanity for the public.
Now, and of course, as we were saying last week, I mean, the top priority for a private healthcare company is to generate a surplus, to generate a profit, isn't it? I mean, that's their kind of fiduciary duty, really, not public service, but private profit.
Absolutely, and the share price is very dependent on how much profit they make. There is a figure called the medical loss ratio. That means they count paying out as medical loss, and the smaller the ratio, that means they're spending less on care and keeping more of the money themselves. The healthier that ratio looks to the insurance company, the greater the stock price, and the more handsome the rewards for the senior executives. So all the incentives are for people to be denied care to enrich the executives, and it's an utterly crazy system. That's just one aspect of it, but it doesn't tell the whole story, because we know billions are actually sucked out of the system in terms of administration and fraud. Fraud is endemic in the American system.
Yeah. What do you make of the corporate media, the mainstream media in the UK? What do you make of their coverage of Nigel Farage's plans for healthcare in the UK?
Well, at best, they ignore it. At worst, when he does utter any of his intentions, they don't challenge any of them. They just let his statements go completely without any scrutiny whatsoever. And in doing so, they are deliberately keeping the public in the dark, because Nigel Farage can get away without any challenge, and the opposite view is not given a platform. So you're only hearing bad stories about the NHS, how it's struggling, how the waiting lists are long, how people are in corridors, how the doctors are going on strike. So you have all this negativity, which the media are very happy to broadcast. And then you have people like Farage given open season to say whatever he likes. So the media are key elements of softening the public up for Nigel Farage.
And the Labour government, of course, they're not that much better, are they, than Reform UK? I mean, just say a bit about their attitude towards the National Health Service and how things are moving in, as things currently stand. Because I mean, the whole premise of your documentary, The Great NHS Heist, was to talk about the attack on the National Health Service, how it's been sort of privatized under our feet, and a lot of the provision of the National Health Service is actually already been externalized to the private sector. So how are things different then in terms of what we're doing at the moment to where we're going, if indeed Reform were to form the next government and proceed along the road of an insurance-based healthcare system?
The way I see it is Labour, Reform, Conservative, Lib Dems, they all talk a good game in opposition, but actually in power, they're sticking to the same process of action. Their public statements do not match their actual intentions. The legislation that has gone through over the recent decades has in fact set up the NHS to resemble American Medicare and Medicaid, which is the state-funded but privately run for-profit system. So we're already there. And what Farage is doing is preparing us for the next step, which would be, for example, allowing everybody to have a personal health budget, which is their slice of the NHS pie, the funding pie, so to speak, and allowing that funding pie to be transferred to a private insurer. And that's the end game. So this personal health budget will be transferable. And if you can afford it, you can buy top-up insurance to replace services that you were getting under the NHS before it was dismantled, and giving the perception that this is somehow a step up. But the reality is, what needs to be done in terms of legislation has all been done, and we have a charade whereby the political parties pretend to disagree slightly, but the direction of travel remains the same.
Yeah, so Labour, Reform, Tory, Lib Dem government were moving in an inevitable path towards even greater privatisation and basically the ultimate sort of complete destruction, I suppose, of the National Health Service as we know it.
Yeah, so more and more services. First of all, they might not be provided. If you've had your A&E shut and you're in dire straits, well, if you don't get to the A&E in time, your NHS provision has ended with your life, right? So that has happened up and down the country. We've learned to normalize this concept of corridor care, where people can't, when they're decided to be ill enough, can't even get a bed and to be properly supervised with doctors and nurses working on specialist wards. So this has become normal. The NHS that we were promised no longer exists. But nevertheless, all the money that supposedly being spent on healthcare, should be spent on healthcare, doesn't reach the patients. More and more of it is being siphoned away.
And we're seeing, aren't we? There's certainly growth in the private healthcare system, obviously in this country that we've talked about. And I noticed something on social media recently. A doctor, Steve Taylor, just take one example. This is Bob, when he was talking about earwax removal. He referred to it being as £115 million business. Talking about GPs not being funded, from basically sort of preventing them from providing this service, and people are able to pay £60 to a local private clinic. This is the choice they face. He was suggesting they're paying £60 to have their ears waxed as a local private clinic, or waiting 6 months or more for the NHS for a hospital appointment at an ENT clinic. I mean, that's just one small snapshot, isn't it, of the sort of difficulties and abuses, really, of the system, isn't it?
Yeah, so it would be a very cheap and efficient way to fund this provision through GP services, but we're not funded to do it. GPs are struggling to meet the demand of patients. More and more work is getting pushed out of the hospitals, so they have to look at, well, what are we getting funded to do? And let's stick to what we're attracting funding for. And we have to be harsh and control our workload by saying, we no longer will do this out of goodwill, because we're struggling to maintain the financial viability of the practice. So we have to let you become a prey to the private sector. Now, to charge £60 or even more to remove wax is extortionate, because this is a relatively simple procedure, takes a few minutes, and this is delivering, I would suggest, several multiples in terms of profit compared to the outlay and the time taken. So this is rich pickings for the private sector. Exactly what we've seen to NHS dentistry is happening to NHS services in general. So, if you go back 25, 30 years, the vast majority of dental care was NHS funded, 80, 90%. That figure has totally flipped. So it's now 10, 20% and funded by the NHS. And the vast majority of that is now in the private dentistry services. And even those dental services are no longer provided by small dental businesses, but they've been consolidated into larger concerns owned by private equity, who have their finance arranged in such a way that they can offshore profit and avoid tax. So it's a double
And
whammy.
that absence of NHS dentistry, I mean, I know you're not a dentist yourself, but I'm sure you've got a view on this, Bob, is actually leaving the oral health of particularly, poorer people, working class people on, on low wages, or maybe unemployed or disabled people in a very precarious situation. And so some of the reports I've seen suggesting that, that the kind of dental difficulties, dental problems that people are encountering are really quite substantial and growing in a way which, we never thought would have been possible, 20 or so years ago. And it's causing a real, I mean, it seems to me we're kind of going back to the sort of scenario as far as dentistry is concerned, or maybe right across the piece, but certainly as far as dentistry is concerned, to the era before the NHS, the era that my mum and dad grew up with, where there wasn't that provision in the public sector, with the NHS, and it's what's happened to NHS dentistry, a foretaste of what's happening really right across the piece in terms of the National Health Service.
Yeah, absolutely. So, that is their intention, to gradually erode access and quality. And if you want to maintain what you've lost, well, you've got to think about paying out of pocket. We've talked about doctor substitution, the agenda of cheapening the workforce over time. So in order for you to access a doctor, maybe 5-10 years time in primary care, you'll have to go down the private route, because NHS will only fund nurse practitioners and physicians associates in primary care. As more and more primary care gets taken up by private equity and other financial interests who are looking to maximize their incomes.
Yeah, I mean, and just in another example, really, there was a report in the Guardian a few days ago talking about the use of the private providers and a kind of boom in unregulated clinics with people, struggling with mental health difficulties. And I think they were citing a case of a young man who was struggling. I think he ended up taking his own life. I think what was the headline? He tried so hard to get help. The tragic results of NHS right to choose for ADHD patients. What's your thoughts on that area as well, Bob? I mean, that's another concern, isn't it?
Yeah, so there are a couple of issues here, but the one I think I want to focus on is this sort of Wild West approach to ADHD diagnosis and service provision. There was an interesting paper published in the last couple of weeks by an independent, quite robust think tank called the Centre for Health in the Public Interest, and they looked at ADHD service provision, and what they found was the vast majority of it is privately provided by companies. But the problem is this is NHS funded without much oversight. And a lot of the provision is without clear contracts being taken out. There's no mandatory regulation. Private equity investors have moved in. The increased cost in terms of NHS expenditure is more than 2.5 times, so 252% rise in funding going into these services. They're delivering a 33% profit margin to private equity, and this has cost hundreds of millions in terms of effect on NHS budgets. And it's because of this huge growth that West Streeting recently announced some sort of investigation or a sort of exercise to look at what's actually going on. And to cap it off, a lot of these service providers aren't even registered with the regulator, the CQC.
No.
Now, if that wasn't bad enough, you have elements of the media constantly going on about underdiagnosis of ADHD. You have a growing proportion of the population who self-diagnose and think they've got ADHD, when in fact, if you look at what's going on in their lives, they're struggling to make ends meet. There's a lot of strain on the family. Their diets are horrendous. They're eating junk food and ultra processed food. They're not suffering with ADHD. They're suffering with coping with everyday life.
Yeah.
And it suits the government's interest, a government which is trashing the welfare state. It suits them to have people wondering whether they've got a condition rather than looking up and saying, how have we allowed our political masters to screw us so effectively? We still can't see what's happening.
Mm. I mean, that really is an indication, isn't it, Bob, that, you know, even if we get the funding right for the National Health Service, that we, you know, that we cut out the, you know, the waste in terms of funding, which is going into the pockets of the private providers with the NHS logo outside. You know, if we sort all that out, you know, if we address the you know, the staffing shortages and things like that, that unless we have a holistic approach, unless we kind of do something about, you know, I mean, they are regulated to some extent, but they're not regulated enough in terms of the food industry and you know, the way in which they're promoting junk food. Unless we, you know, address the poverty in Britain, the housing crisis, you know, the fact that, as I keep going on about, you know, look, sixth biggest economy in the world, we've got, you know, 15 million people living in poverty. And that, as you are just alluding to there, Bob, is driving some of these symptoms, which are then, you know, as it were, being misdiagnosed. So would you agree that even if we, as I say, get the funding right for the National Health Service, get the organisation of the National Health Service right, so unless we have a kind of holistic approach which actually addresses, you know, poverty in this country, we're still going to have many of these problems. We may be able to eliminate some of them, but we're still going to have a substantial crisis on our hands, aren't we?
Absolutely. You have to deal with people's economic circumstances. Otherwise, you have an explosion in additional need, a need that has been created by the economic system. You know, we call these diseases of despair. Alcoholism, drug addiction, criminality, they all have a knock-on effect in terms of cost, be it on healthcare, social care, or the criminal justice system. So we're ending up spending more for failure because the system is not set up to do the best for the public. It's set up to deliver financial returns for the City of London and the private sector. And the worse we go down this trajectory, the more the government relies on scapegoating the sick, scapegoating the poor, scapegoating immigrants, or blaming the staff who are trying to hold things together. And, you know, we have been, unfortunately, there is a paucity of accurate, robust, fair analysis on the media. So once again, the public are softened up for reaching for an easy but totally false solution to the problem, which is time and time again, it's immigration, isn't it? Or it might be blaming people who are attending A&E. There's always somebody to blame, so that the powers that be keep the anger, the direction of the anger, away from them.
No, indeed. And just a quick reminder to our listeners, if anybody's got any comments or questions that they want to put to Bob, feel free to just put your hand up and we will bring you in. But yeah, just on that point, Bob, I mean, you know, given the direction of travel of this government, the cuts in social security payments to some of the most vulnerable people in Britain, the fact that reform, which is, you know, riding high in the polls and is on course potentially to form the next government, is talking about, you know, even greater cuts in that regard. I mean, we're heading towards a perfect storm, aren't we? I mean, you know, with a privatized insurance, I'm talking about reform now particularly, but obviously not much better with Labour, but with a privatized insurance-based healthcare system and even greater desperation, even more economic insecurity for people, this is going to, I mean, the problems that you're articulating, outlining, it's going to get much, much worse, aren't they?
Yeah, unfortunately, that is the reality. We know from various studies that have been reported, the cost of austerity from 2008 onwards has claimed hundreds of thousands of lives. So we know the effect, and this is business as usual amongst our our political elite, is to carry on this trajectory. They don't seem to be able, ideologically or for whatever reason, to change course, even though they know we're heading into the rocks.
I mean, a case in point, of course, Bob, was the government's decision. I know they've sort of slightly pulled back on that, but their first year in government, they scrapped the winter fuel payment to pensioners, even though the Labour Party's own impact assessment before they got into power, admittedly this was an impact assessment undertaken under Jeremy Corbyn's leadership, suggested that just under 4,000 people, 4,000 older people would lose their lives, would die as a result of cold-related illnesses. And I'm sure as a GP, you see patients who are suffering the effects of cold houses and so on. I mean, this is just once again another small snapshot of the consequences. I mean, death sentence in reality in that particular case, but the consequences of cutting support for the most vulnerable people in the country, leading to devastating consequences and potentially greater costs ultimately if people suffer ill health and end up in the National Health Service or whatever. And there's obviously greater costs then associated with that. There's a lot then, of course, to the economy as well in terms of their ability to contribute to the economy and so on. I mean, it's a massive problem, isn't it?
Absolutely. And there's overwhelming evidence of the effects of these policies, yet they don't want to change them. And you can only conclude that they're happy with this mass loss, preventable loss of life. It doesn't seem to bother them. And we have a political system whereby at most elections you don't really have a choice. You have several parties who all sing from the same hymn sheet. They're all neoliberal. They're all free market fundamentalists. They pay lip service to the welfare state. They pay lip service to public services in general. Meanwhile, they defund them and flog off the assets. And we're having a very quiet setting up across the country of sort of corporate fiefdoms, these special economic zones where even the weak laws we have to protect the public and to protect workers' rights will not have any power. So the madness of deregulation and removing protections continues. In fact, you could argue it's accelerating in certain areas, and there doesn't seem to be any concern in terms of the cost to standards of living and lives.
No, indeed. It's a real travesty, Bob, and they certainly seem, as far as I could tell, to be in the pockets of those vested interests that you identified there. And another indication of that is the fact that they're looking, despite a manifesto commitment, to revisit the private finance initiative. And I think it was around nearly 40 MPs, 40 Labour MPs are. I mean, there are not many decent MPs if you consider any of the Labour MPs are of any credibility, but even 40 of the less than adequate Labour MPs have warned that the government would be reneging on its manifesto if it went ahead with the proposals to use the private finance to fund NHS facilities. Do you think they are likely to go down that road in spite of what we were led to believe before what we were told before the election, that the National Health Service would be publicly owned and publicly funded? Which kind of gave the indication that the private finance initiative was a thing of the past.
Yeah, I think it just goes to show how meaningless these pre-election promises are. This is just the latest betrayal, and it's flags up the weakness of our system, that you can say whatever you like when running for office and do entirely the opposite. There is no accountability. I think we have an issue of politicians and the cabinet. Well, they have something called Crown indemnity, so they could bring out a policy that causes a human tragedy, but none of them will face any jail time. So they're quite confident that they can do whatever they want to get away with, as long as they don't personally, as cabinet members, lose their seat. And I think some of them are quite resigned to losing their seat as long as they go on to a healthy, well-paid job in the private sector, in the industry that they've helped to profiteer under the current circumstances. You know, there's no end of money to line the pockets of the corporate sector, and we had a very blatant example of this during the pandemic, where tens of billions were handed out in dodgy contracts for PPE and all the rest of it, which was an utter waste of money. And there has today been no accountability whatsoever. You would have thought the Labour Party, the Labour government would say, well, let's have some accountability for the actions of the last government. It doesn't happen. There's an unwritten understanding amongst the political class that we won't punish you for your faults, your mistakes, your failings, as long as you don't punish us for our failings. It's all going to be rhetoric, but no action.
And of course, and that gives the lie, doesn't it, to the notion that, you know, an affordable society a good society is unaffordable because, you know, money was no object. And money really is no object, you know, for a government that issues its own currency, something I keep banging on about. I mean, the only impediment on government spending is the availability of, you know, real resources in the economy. You know, the availability of workers and raw materials and so on. I mean, it was John Maynard Keynes who said many years ago, I think during the Second World War, that anything we can actually do, we can afford. And, you know, the situation economically then, I mean, you know, Britain's had a fixed exchange rate in those days. I mean, they didn't have the floating fiat currency that we've had since 1971. So there's much more flexibility now for governments to, you know, invest in a decent society, in public services. And it's interesting, isn't it, that there's never a shortage of money for war. As Tony Benn used to say, you know, if we're going to find the money to kill people, we can find the money to help people. But this whole, you know, move, you know, latest example of reneging on a pre-election commitment in terms of, you know, public funded National Health Service, kind of brings democracy, doesn't it? It brings, you know, the political process into disrepute, and then honourable would-be politicians, you know, I think who would genuinely, you know, follow through on their pledges, as it were. I mean, they get tarred with the same brush. People just kind of feel, you know, politics, democracy is just not worth. It's just not worth participating. I mean, that's one of the reasons I think that participation in elections is massively down, isn't it, compared to how it used to be?
Yeah, and I don't think the people who pull the strings are shedding any tears over that. They quite like apathy. They love apathy, because the more people remain disengaged, the more they can get away with. So, you know, it's a win-win situation for the political class. And what they do is they argue the toss over a few percentage points in electorate here and there, over minor nuance in actual policy delivery, or at least the rhetoric surrounding policy delivery. But actually, the outcomes are much the same.
Yeah. And just to conclude, Bob, and to sort of change gear a little, I'd just like to get your thoughts on that tribunal ruling regarding the Darlington nurses. This is over the kind of trans issue and changing facilities and changing facilities with a trans colleague, where I think the tribunal ruled that the nurses had experienced harassment, but the claims against the trans colleague were dismissed. What's your thoughts on that? And where are we going with this whole agenda? It's a bit of a minefield, isn't it?
Yeah, I think it is a minefield, but I think it's a minefield of the creation of the oligarchy and the sort of political elites.
Yeah.
Because the more they can divert us into identity politics, the more they can do what they like. So I think the outcome of the tribunal is a good one. To suggest that ladies allow their facilities to be used by men claiming to be ladies is a problem. I wouldn't want my daughter having to change in the same room as somebody now claiming to be a woman. So I think it's a return of common sense. But the detail of the outcome, if you listen to the complainants, the people who brought the case, the nurses who brought the case, they were treated horrendously by their employer, the NHS Trust. They were ignored. Alternative arrangements were not sought. And it just shows the level of disrespect and perhaps incompetence of senior managers in these trusts. Because why did they ever let it get to this situation?
Yeah.
Right. So we are led by donkeys, and the more stupid and incompetent you are, it seems to me, the higher you go up in NHS management and politics.
Yes, indeed. Well, I think it's right across the piece, it seems to me, Bob, in my experience. But I mean, there is an issue, of course, isn't there? I mean, and I think we have to be humane and recognise, the needs, if you like, of trans people. I mean, how do we square that circle, Bob? Because I mean, I heard some of the interviews with the nurses, and they were very adamant, very strong in saying that they were not anti-trans, and and they didn't wish any ill on the colleague that was the centre of this particular dispute. But I don't think we can. I mean, or can we? I don't know. I mean, what's your thoughts? We can't just sort of ignore that. I mean, there is an issue. I mean, there are trans people, and I think their rights have to be respected. As I say, how can we square that circle? How can we recognise the anxieties, the concerns of people like those nurses, and there are many other people out there who've articulated some of those concerns, but also respecting the rights and the sensitivities around the trans community. I mean, is there a way of squaring that circle, in your opinion? I mean, as far as the National Health Service is concerned, or maybe widely, you may have a view.
Yeah, I think all they needed was a sort of private, separate changing room. I think that seems to be a very simple solution. You shouldn't have this sort of competition about whose rights you're protecting. Certainly, why don't we make arrangements where everybody's happy? Keep the nurses happy. We want an all-female changing room, and provide a changing room where a trans person can get changed comfortably and their dignity is respected. But there seems that the narrative is that trans people are having certain rights denied to them. But as far as I can understand, they have the equal protections in law. They're not allowed to be assaulted. They're not allowed to be discriminated against in the workplace. I'm not absolutely sure what rights are being denied to them, other than using facilities designed for women.
Oh, I've lost you there, Bob.
Yeah, so
yeah, go on, Bob. I lost you there.
Sure what are the rights that are being denied? These are missing rights that have been fabricated.
Yeah.
They should be entitled to the protection of the law. They should be entitled to the protection of their employer, as everybody else. We should all be treated equally.
Yes.
But treating one group equally doesn't mean you disadvantage another group.
No,
that's not how rights work. And I think this argument, as I said earlier, is designed to keep good people fighting over things that aren't really the crux of the issue. The big issues that affect men, women, trans people are having a decent job, being able to afford to live, and having access to healthcare. And we're spending less time talking about those issues.
Amen to that, Bob. I mean, look, the last thing I want to see personally is anybody discriminated against, having their rights compromised in any way, shape, or form. Everybody should be treated with respect. But it seems to me this is a kind of wedge issue, which is a diversion. That's not to minimise the concerns of trans people, but while I mean, look, what I'd like to see is the entire sort of community, if you like, demanding better National Health Service, and getting rid of the privateers, and eliminating poverty in society, and all the points that you've just made, Bob. But the danger is with an obsession with identity politics, a focus on identity politics, is that we get a bit sort of sidetracked on those single issues. That's not to minimize the importance of those issues, but when you elevate them, it seems to me above a recognition that there is a sort of structural inequality in society that could be economic inequality that could be resolved quite easily, actually, in this country. We are the 6th biggest economy in the world. Let's remember, and he also, I think, he has the perverse effect of enabling. I always remember Boris Johnson saying that he'd got the most diverse cabinet in history, but. I mean, look, we've got more women and brown and black faces around the cabinet table, but I mean, they represented the interest of the of the top 1% of society. They represented, corporate capitalism. They represented continuity neoliberalism. They championed the war machine, just as the current Labour government is doing. I mean, that's not a diverse cabinet, is it? That's a cabinet of the elites, surely.
Yeah, and I think we've got a pretty prime example at the moment of the Home Secretary, who's a Muslim, throwing her weight around to get the Chief of Police in the Midlands to retire early because he didn't allow racist thugs to come and support their football team.
No, indeed, absolutely disgraceful. Listen, Bob, we're about out of time again today. Let me thank you again for your erudite contribution. It's been really interesting. Apologies to listeners that we had some technical difficulties at the beginning and had to start again, but hopefully it hasn't ruined the impact of the discussion that we had too much. So thank you for listening. Thanks again to Bob, and we'll be back next week. Technical difficulties willing. At the same time at 5 p.m. So look forward to seeing you all then.